Sinusitis is an inflammation or swelling of the tissues lining your sinuses. You need to know that sinuses are structured inside your face. These structures actually get filled with hair. Also, bacterial infections, viral infections, and allergies can irritate them, causing them to get blocked and filled with fluid. This blockage can lead to increase in pressure and pain in your face. They can lead to nasal congestion. They can lead to a form of a stuffy nose and other symptoms. Another name for sinusitis is called rhinosinusitis. Now, what are sinuses? What are sinuses? Your sinuses are four-paired cavities, which are spaces in your head. A narrow passage connect them. And sinuses make mucus that drains out of the passage in your nose. This drainage help keep your nose clean and free of bacteria, allergens, and other germs, which are pathogens. Now, what are the types of sinusitis? What are the types of sinusitis? The types of sinusitis can be described based on, the time frame. How long is it going on? Is it something acute, subacute? Is it something chronic, or is it something recurrent? And also, another description of the type is based on, the pathogens, the bacteria or viruses or fungi that is actually causing, this type of sinusitis. Now, acute sinusitis, the symptoms might include nasal congestion, drainage, facial pain or pressure, and also decreased sense of smell. And this acute sinusitis, they usually last less than 4 weeks, and it's usually caused by viruses like common cold. Okay, and subacute sinusitis symptoms usually last between 4 to 12 weeks. Whereas in chronic sinusitis, symptoms last at least 12 weeks, and bacteria are usually the cause. You remember I just mentioned right now versus the acute sinusitis, which is mostly caused by viruses. And also we have what is called a recurrent sinusitis, recurrent sinus infection. And with the recurrent sinus infection, symptoms comes back, 4 or more times in a year. And when these symptoms comes, they usually last at least 2 weeks each time. Now, I'm going to be speaking about another type of sinusitis, which is called fungal sinusitis. What makes a fungal sinusitis a little bit different than the other types of sinusitis is due to the fact that fungal sinusitis are usually happen if your immune system is weakened or suppressed. Therefore, it makes it a little bit more serious, than other type of sinusitis. Now, another question someone might ask me is that what causes sinus infections? What causes sinus infections? Sinus infections can be caused by, a variety of causes, ranging from, viruses, bacteria, fungi, and allergens. Okay. And we have to understand that, sinus infection can be triggered by various factors. Number one, common cold can trigger a sinus infection. When you have, flu infection, a flu, which is a viral infection, it's called the influenza. When you have bacteria in your system, like Streptococcus pneumoniae, Haemophilus influenza bacteria, Moraxella catarrhalis, nasal and seasonal allergies. Okay, so someone might ask me again, what are the risk factors for sinusitis? We need to know that some people are more likely to get sinusitis than others. These factors include nasal allergies, asthma, nasal polyps, which are growth in your nasal passage, a deviated septum. Now, what is a deviated septum? You have to know that a septum is a line of tissue that actually divides your nose. Therefore, when you have a deviated septum, it actually means that this line is not straight, it is a little bit deviated, and these can cause blockage. So another risk factor for sinusitis is a weakened immune system. Weakened immune system in conditions like HIV or cancer or certain medication. And another risk factor is smoking. When you smoke, it carries a risk for sinusitis. Now, someone might ask me, is sinusitis contagious, or is a sinus infection contagious? A sinus infection itself isn't contagious, but the virus and bacteria that causes this infection usually are. In most infections, when you are sick and you expose yourself to others, then that can actually increase the risk, of spreading this infection. Now, another question someone might ask me is, what happens if sinusitis is left untreated? What happens if sinusitis is left untreated? You don't usually need to treat sinusitis. Most times, or oftentimes, it goes away on its own. But very rarely, when you have this sinus infection and it requires treatment and you do not go for treatment, they can lead to life-threatening infections. Especially this happen if the bacteria or the fungi, if they've spread to other locations like nearby structures or bones, if they spread to your eyes or to your brain. Now, another question is, do I need antibiotics every time I have sinus infection? The simple answer is no. Why? Because your provider would often see how long your symptoms last before prescribing antibiotics, and you need to know that many sinus infections are caused by viruses, and you can't cure viral infections with antibiotics. And also, in people who often, when they are sick a little bit, they often love to use antibiotics over and over again. You have to realize that when you do this, you subject yourself, to antibiotic resistance and side effects. For future infections, when you are infected or when you are sick and you actually need an antibiotics, when your body system has actually developed a resistance to these antibiotics, future infections might be harder to treat. I hope you're able to learn one or two things from my video.